Hey everybody, welcome back to another Cabral Concept. Today we are going to be going over a popular Cabral house call question. So every single weekend, if you're not aware, I answer about 10 questions from the community. Typically it takes 6 weeks or so to get your question answered. You can ask at stephencabral.com/askcabral. But if I see one consistently come up, each and every month, I like to turn that into a full show because of course the Cabral Concept is really all about our global health community. Well, one that's come up over the years is this consistent theme around dry mouth or dry throat, as well as kind of a persistent cough. So it's a cough that's not a cold, just a clearing of the throat, clearing of the chest. And what I want to do is break down all of the main reasons as to why I see this in a clinical practice, and then of course what you can do in order to heal. So let's dive right into it. All the possible causes for the main reasons. Again, the main reasons I'm going to go over right now. There's about 7 of them. The first one is this: as people get older, this is not the whole genetics or anything excuse like that, but people produce less stomach acid as they get older. They also produce less saliva as they get older. It's actually called Zerostomia or Zerosttomia. And this is something clinical that happens with the body. Now, the healthier the body, the less likely this is to happen. Meaning, like, some people, they may not even see the first signs of it till they get in their 80s. Those are healthy individuals. They've then started to produce a little bit less saliva. We'll talk about maybe what to do for a more natural way in the future, but that's an important one to look at. So that's just the first and foremost. Very rarely is that the case. And most people that I see complaining about it are in their 40s, 50s, and early 60s. And that's certainly not the age to be producing too little saliva. So I just want to get that one out of the way, because oftentimes a medical doctor would say, well, it just happens with aging. Not necessarily. No. Yes, aging in like 80s, right? Okay. Second one is this: specific medications. This is really important. This is the main reason why people get cotton mouth, dry mouth, all of those things. Regardless, this is on a daily basis. Some people get up for public speaking, they get a dry mouth. Okay. Why is that? That's anxiety. That's sympathetic nervous system stress, right? Because in the parasympathetic, you produce saliva. In the sympathetic nervous system, things start to dry up, right? So let's just kind of keep that in mind. That might be a little bonus one there for you, but I'm talking about chronic based dry mouth, dry throat, cough. All right. So what are the medications that people are on that you could look in your medicine cabinet, see if this might be affecting you? And also keep in mind that people don't equate it to the medication because they've been on it for 6 months or a year and then they started to get dry mouth. Remember, these things don't happen right away. Sometimes they can, but it sometimes takes months or even years for these things to happen. So antihypertensives, that means if you have high blood pressure, if you're on blood pressure-based medications, might cause a dry mouth. Antihistamines, so allergy-based medications, might cause dry mouth, and that includes some H2 blockers and different acid blockers in the stomach. Antidepressants can cause dry mouth. Diuretics, which could be used for blood pressure as well, can also cause a decrease in saliva. There's actually over 400 medications and counting that can cause dry mouth or cough as a side effect. So kind of a clearing cough, that can be a side effect. The next one, silent acid reflux. We've actually talked about this before, LPR. Why this is important is that many people have acid reflux without the heartburn. And I want to share with you why. They're on medications that do not allow for what's called the lower esophageal sphincter of the stomach. And I wish I had my model with me here today. Actually, I do have my model right here. He already has his guts removed, so this will be very helpful. You can see the esophagus, if you're watching this on video, come right down. So it comes from the mouth, comes down about a foot or so, right in the middle of your rib cage. So you feel your solar plexus. If you trace that down, that's the xiphoid process where you do the Heimlich maneuver. Well, right around that area that moves off to the left, you have something called the lower esophageal sphincter. Now, that is a muscle that keeps the food in the stomach and doesn't allow the acid and food to come back up your esophagus, keeping it a one-way street. Really important. But if you have a hiatal hernia, so you actually have a hernia in near that area of the upper stomach, the fundus, that will create an opening that allows that. Some medications allow that. So even if you're taking acid blockers, you might be negating a lot of the acid, but there can still be some, or poor food combinations can push a little bit of that acid up. When that happens, you can do throat clearing, burning in the throat and esophagus, not the heartburn, but you can actually feel that. That can also lead to, which I'll talk about in just a little bit in a moment, some postnasal drip-based issues as well. So keep in mind that silent acid reflux for even babies is a real thing. My oldest daughter, believe it or not, when she was very young, had silent acid reflux. We had to work on that. We had to fix that. And fortunately, we did. All right, the next one is dehydration or electrolyte imbalance. This is so important. A lot of what they blame on people in their 70s and 80s with low saliva production, they're so dehydrated. People are so dehydrated. What does that mean? It's they're literally not getting about half their body weight in ounces of water per day. And so when you think about that, like that's a lot of water. It's 8 to 10 glasses of water for most people. Some it's 10 to 12. And if you sweat, it's even a little bit more. You might say that's an excessive amount of water. It's not, because you have to understand is that you're getting it from fruits and veggies. Those are 90% water as well. You're getting it from the water that you need, the teas. But a lot of people, and a lot of older people that I know, and I work with their children as well, that are working with them, is that they say they never drink, or they have a 16-ounce bottle of water for the whole day. I mean, that's 4 bottles short that most people need. So you're not going to make a lot of saliva if you're dehydrated. Now, people are also drinking waters from plastic bottles that have been shipped all around the world and microplastics and all that. We won't even talk about that here today. But the water is not being absorbed properly with the body. That's why when you get water from fruit or water from veggies, they're already packed, right? They're packed with their mineral-based nutrients and enzymes. Very easy for the body to utilize, right? But if you have a glass of water and you're immediately urinating, like you may not be absorbing that water. So just adding a pinch of sea salt as needed, a squeeze of lime for potassium can be really beneficial for most people. Oh, don't overly salt. Again, we live in a world where if a little is good, a whole lot is better. You don't need a tablespoon of salt, in a glass of water. People can go way overboard. Now, again, there is no all for one. If you're sweating profusely, you certainly need more salt. Like when I go for a long run and I'm sweating, I certainly take in a good amount of salt. It just depends on, are you sweating, not sweating? Do you have low blood pressure? Do you have high blood pressure? Like all of these things really do matter. All right, but let's get some electrolytes in with that water. It even can help with taste, which again, get people to have them drink a smoothie, right? People that are dehydrated. You don't have to put a ton of fruit in. You can put a little bit of berries in there. You can put in whatever you'd like. But that's a nice way for people to also rehydrate and absorb that water. Number 5 is microbiome disruption. What does that have to do with dry mouth, dry throat, and a cough? Well, one of the big things is that when you are not properly feeding that gut microbiome, you can create an entire host of issues upstream. So what that means is that when you imbalance the bacteria in the gut, you can create more inflammation. Typically, it's bacterial overgrowth, it's bacterial dysbiosis, sometimes called SIBO, small intestinal bacterial overgrowth, or it's candida or yeast overgrowth. Those are the 2 most common. But some people also have H. pylori, which can cause acid-based issues and ulcers in the stomach. And some people have parasites. All of these things can cause inflammation. That inflammation, especially with leaky gut, can even trigger autoimmune issues. Then people get put on medications and acid reflux blockers, and they end up with Barrett's esophageal-based issues, and they wonder why they have dry mouth and cracked teeth and all of those things. Because if you keep having drier and drier mouth, your teeth will dry out as well, and they can crack. So all of these things can lead to upstream-based issues. This is why I'm always saying check your gut, right? Run something like the Candida metabolic and vitamins test. Why? Just make sure you don't have the bacteria. Make sure you don't have the yeast-based overgrowth. Really important to look at that, because although it's a slower, longer-term growing issue, it could be the underlying root cause. Number 6, this is a big one, sleep apnea or mouth breathing or postnasal drip. All of these things are greatly exacerbated when lying down on your back. Not necessarily side, we'll talk about that in just a second, but when you lie on your back, if you have a little inflammation in your sinus passages from allergies or, histamine-based issues, whatever it is, you can have a little bit of fluid, a little bit of mucus drip down as you're sleeping. It can irritate your throat because it can move right through, causing then what? A little tickle cough, dry throat as the inflammation starts to go there as well. Or a little bit of reflux from it dripping into your stomach and or lungs. Lungs would cause the coughing. So that is not unheard of. That's actually quite common in my practice, especially with people with asthma, allergies, histamine-based issues. All right. The next one I mentioned is sleep apnea. That's more or less straightforward. If you snore a lot at night, it is a good possibility that you have sleep apnea. The best thing about sleep apnea is it really can be fixed. It can be fixed a lot of times with weight loss, with greatly reducing inflammation. My highest recommendation, do a 21-day detox at stephencabral.com/detox. Do that for 21 days and sleep on your side. Put a pillow between your knees, lie on your side, head aligned, spine aligned. Tape a golf ball to your t-shirt if you wear a t-shirt to bed. Prevent you from rolling onto your back. It is a game changer for many people. The 21-day detox greatly decreases inflammation, balances out the body. You're going to lose at least 10 pounds, and it can be a game changer. So that's it. So definitely give that a shot. All right, and then the mouth breathing dries out your mouth. I mean, that's very straightforward. It can actually cause tonsil-based issues in children as well. You're not meant to be breathing in the ear through your mouth for that larger part of the day. And if you're in bed for 8 hours or kids 10 plus hours, that's a long time to be mouth breathing. You really want to be able to breathe through the nasal passages, especially as a child before the age of 10 years old, because it's also shaping your face and jaw. Really important that your tongue stays to the roof of your mouth. All right, the last one is this: low stomach acid. Hypochlorhydria. Why does that matter? Well, we talked about it a little bit, but if your stomach acids are dropping, it can cause reflux-based symptoms for one of the reasons with that lower esophageal sphincter staying open at the bottom of the stomach, and so a little bit coming up. But another one is just you're not properly breaking down nutrients, magnesium, calcium, B12, zinc, and others, and you are creating more inflammation from the process of literally, and this does truly happen, putrefying proteins and carbs in your stomach. So not ideal that this is happening. And again, there's all natural ways to do that. If you do have low stomach acid, you can at least just start with a tablespoon of apple cider vinegar and dilute it in water, 6 to 8 ounces of water at a meal. You could do a glass of ginger tea. You could just take 2 or 3 daily digestive enzymes, but at least start there to help with that improvement. Now, right away, people say, well, my mom or dad, they're using lozenges. Just be careful with that. A lot of these lozenges are just pure sugar. Now, I know you'll want to help with the dry throat and totally get that. There are more natural-based variations. One, there are zinc lozenges, zinc gluconate, and others. Those can be fine, but 2 to 3 weeks, you don't want to be taking those in all the time. They work better when you have a cold or you have something going on, then you take them in. All right, again, fine not to do, no issue doing one a day. Some of them are sugar-free, and that can be beneficial, but you want to look for sugar-free that's truly sugar-free and natural. So you don't want the aspartame or the Splenda or anything like that. You really want to, and the sugar alcohols don't do well for many people as well. The only one that you might want to think about for the mouth that can be beneficial that it's shown in terms of cavities is something like xylitol. But you're still swallowing these things, so it's not always my favorite. All right, so I like stevia, I like monk fruit, lohan. Those are all totally acceptable. But then one other good one is just true Manuka honey lozenges. There's a couple great brands that have ginger Manuka honey. That's a nice one to get. They're single digits in terms of sugar. They're also all natural, and Manuka honey is actually beneficial for the oral microbiome and if you were to have any bacteria in the gut. So that could be one nice way. And again, this is just short term because you're working on fixing the underlying root cause, which is what we shared earlier. The other one that you want to do is you want to make sure that you're not using antiseptic-based mouthwashes. I've done a podcast a few months back, really important. I'll see if we can find it and link it up today. This is episode 3434, by the way, if you want to find all the show notes, stephencabral.com/3434. But it shows that it can actually increase type 2 diabetes and high blood pressure when you use alcohol and antiseptic-based mouthwashes. Not all natural oil pulling, which you could do with the sesame oil, coconut oil, etc., but it can be a real issue, honestly. And so this is the truth. And why? It changes the microbiome in the mouth, which then you produce less nitric oxide. If you produce less nitric oxide, your blood pressure levels may increase. Again, this is real science. It's not just natural medicine. This is real science. All right. Couple of things I want to share with you: rebalance that gut microbiome. Make sure you don't have leaky gut. If you only can run one lab, run the Candida metabolic and vitamins test. If you can run 3, it's called the gut bundle, and it's the bacteria and parasite stool test along with the IgG food sensitivity test. The next is be careful with foods that are trigger foods for you: spicy foods, fermented foods, aged foods like aged cheese that might kick up the histamines or the postnasal drip. That's a really important one as well. And again, if you have the sleep apnea, let's work on that with the previous tips that I gave you before. So all of this is fixable. It really is. I gave you all the different reasons: the electrolytes, the dry mouth, the dehydration, all of them. We'll link them up today at stephencabral.com/3434. I can link up the labs. I can't link up any nutritional supplements like the functional medicine detox or anything else. But of course, you can always find those at stephencabral.com/shop. That takes you over to Equilife, the company that I formulate for. And you can find everything there, from the daily omega-3s that help with inflammation, the vitamin D3 that pretty much every human should be taking, and the daily nutritional support or daily activated multi that, again, almost every human should be using. Hopefully this was helpful. Have an amazing day, everybody. Do feel free to share the show with anyone you believe it could serve. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.